Well, good afternoon. My name is Mark Skidmore, and I am the director of the North Central Regional Center for Rural Development. Welcome to today's webinar. And today we've got, I think, a really great topic. The title of the webinar is Reconceptualizing Quality, Affordable Child Care as a Public Utility, Family, Child, and Economic Developmental Perspectives. And so I'll introduce the presenters in just a moment, while you're on, you can see that we have some upcoming webinars as well. And so I just wanted to bring your attention to the one coming up here in about 10 days. This is part of our opioid prevention webinar series, Mental Health Promotion and Opportunity for Opioid Overdose Prevention. You can also see several other webinars that are coming up in March. So we've got a busy series here this spring, so keep that in mind. So today our presenters are Bradford Wiles and Holly Hatton Bowers. Both of them are from Kansas State University, along with Jesse Piper. And then we also have, as part of the team, Allison Brennan, who's a postdoc with the NCR-CRD. The three presenters will include Bradford, Jesse, and Allison. Holly is in New Zealand right now, so she won't be able to join us. And so we wish her well in her travels. And so with that, I'd like to pass it on to Bradford, and he'll get us started. Oh, and one other thing. If you do have a question or a comment, please feel free to just type it right in the chat, and those doing the webinar will catch that along the way, or I might highlight it at some point. Okay, with that, thanks so much for being here and giving the webinar.
Great, thanks, and I trust you can hear me just fine. So we really appreciate the opportunity. Yes, my colleague Holly, who is at UNL, is in New Zealand at a conference, and there are funny stories abounding about that, but I'll just leave that we miss her terribly. But she was able to help us put this together and has been absolutely instrumental in executing all of this work, so we appreciate it. So I'm just going to start with an overview of what we're going to cover today. We're just going to do really brief introductions. We're going to talk about some of the theoretical perspectives. So if you look at the title of our talk, one of the really important elements is how do we conceptualize and then further reconceptualize the notion of access to quality, affordable childcare. And then give some overview of the work that we've done through the NCR-CRD and their support, get to the reconceptualization, and then talk a little bit more about our next steps, of course, provide our acknowledgments, and then there'll be some time for questions and answers at the end. So with that, we'll start out with our quick introductions. I'm Bradford Wiles. I'm an assistant professor and extension specialist at Kansas State, and my main area of interest is really in rural families, and particularly in the interface of systems and their effects on the family, child, and economic development of rural families. Holly, I think, would echo essentially those things. Jesse Piper is here with me, so I'll let her give her quick introduction.
Hi, as Bradford said, my name is Jesse Piper, and I am a doctoral student at Kansas State University in Applied Family Science. My research area is grand families, but Bradford called me on to the project because prior to coming back to school, I was a director of a local preschool. So pretty invested in childcare in our area.
And Allison?
Hi everyone, this is Allison Brennan. I'm a postdoc with NCR-CRD, and I'm a developmental scientist, so really my focus is on the unit that I tend to focus on is the family and thinking about development in context. And prior to my postdoc, I was a parent educator in Cass County, North Dakota.
All right, great. And then I want to really emphasize that there are so many community partners that are involved in this work that to indicate that our team is just the four of us is just simply could not possibly be less accurate. We have worked together, of course, as a leadership team, but without our community partners on this work, it simply would not be nearly as helpful nor informative. And so what we're going to do to start is just ask you all a quick poll question. So there's going to be a poll that'll pop up on your screen, and then you'll have a little bit to answer, and then we'll go through it. All right, looks like, yep, all right, good. I think everybody's had a chance to vote. 5, 4, 3, 2, 1, and all right. So most of you, well, wait, that's not true. A plurality of you indicated that 13,211 was the correct sum for the yearly cost of an infant to attend center-based care. And those are crucial qualifiers there as well. Infants tend to cost more, and center-based care tends to cost more. But because I am a social scientist and I know that everyone would choose the highest number, or at least most of you would, I did not make it the highest number, but it is close. It is $12,272. Now, keep in mind that that figure is supposed to be 10% of a family's total income. So in order to do that, of course, you would need to make $122,720 a year for that to be 10% of your income. So seeing as how the median household income in our counties, both in Nebraska and Kansas, is right around $60,000. That presents a bit of a problem. So we wanted to look at a number of different elements of that. So there we go. So I do think that that's instrumental, though, and hopefully sets the scene for what we're going to really get into. But I wanted to also acknowledge some of the genesis of how we got here. So our program leaders in the North Central region brought us together in Chicago to really talk with other extension specialists about what opportunities we have for collaboration. And then, of course, having the North Central Regional Center for Rural Community Development. Yeah, that's not a mouthful, I swear. Having that opportunity presented just a great chance for Holly and I and Allison then to then work together along with Jesse. And I really can't emphasize enough that all of us have contributed equally to the design and execution of this work. So while there have been different steps and different ways of and particularly different chronosystems. So we'll talk a little bit about that in just a minute, but each of us has contributed equally. And so getting to that, here in Kansas, I was already part of the Potawatomi County Task Force, which is grew out of some economic development work here in Kansas. And it turns out that they had formed this childcare task force that was chaired by Aaron Tynan, who is our extension agent in Potawatomi County, which is the county adjacent to Kansas State. And then when we started looking at ways that we could work across states in Nebraska and Kansas, what we learned is that Nebraska has a tremendous opportunity to also do some needs assessments and try to figure out what we can do. And by the way, the outcome for our grant proposal is the larger grant proposal to external funding sources. And Holly and I, and actually our whole team, are working on that currently. And so, but it gave us a really good opportunity to, at first it was a real conundrum because we were staggered, but it actually ended up being extraordinarily beneficial because Nebraska was able to benefit from the lessons learned that we had here. And there were several. Everything from the way that we had our survey. Initially, we had it in 4 separate surveys on Qualtrics, to then we ended up doing one. We were able to look at some of the different questions we asked and make them more accessible. And Allison will get into some of those details a little bit later. And then I really want to point out to the Herculean effort that Holly and her colleagues in Nebraska Extension were able to accomplish through her leadership and her collaboration with those extension educators because of this staggered nature. So it at first came as a somewhat of a deficit, but it ended up being a huge benefit because we were able to extend those lessons learned. So briefly, there have been the sociocultural historic perspective to access to quality affordable childcare has really been, it's for the children, right? We know that children need care. We know that high quality care is beneficial for them. We know all the tremendous developmental outcomes that come from high quality early childhood education, right? And please make no mistake, that's what we're talking about. We're not talking about babysitting. We're not even talking about daycare. We're talking about childcare and early childhood education. Unfortunately, it's for the children doesn't tend to sell very well for decision makers, particularly policymakers. And so around 2004, Mildred Warner at Cornell and her colleagues started thinking about childcare more as an economic developmental component rather than just the child development. And she really contextualized childcare as economic development, both in the jobs that are created through having childcare, so for early childhood educators and those, but also as a workforce development component, meaning that eventually these young children will enter the workforce and generally they will stay in and around the towns in which they grew up. But then, of course, Yuri Bronfenbrenner, again, out of Cornell, informed our view of individuals, families, and communities in context, and in particular, looking at the multiple permeable boundaries between individuals, families, and communities, and how these things affect and are affected by one another across the lifespan. And then what Allison really brought to us as well was the community capitals framework, which really is this notion of spiraling up, of being able to identify assets and put processes in motion that can essentially activate the gestalt of it all, that the sum is more than just the parts. And the irony of this, of course, is that unbeknownst to me, their work here in Kansas State actually occurred in the town of Wamego, which is in Pottawatomie County, Kansas. So that was a real eye-opener, but it has really informed our work. But as you can see, these things are somewhat disparate, meaning there's a child development angle, there's an economic development angle, there's a little bit of family in there, and then there's the community as a whole. And after we talk about our work, we'll then be able to talk about how we would sort of modify some of our theoretical perspectives to account for what we found in our data. So one of the things that will be helpful as we go forward is to think about access and quality and affordability. So this quick matrix, just 4x4, gives you a perfect insight into the importance of quality, affordable childcare, right? So if it's high quality but it's unaffordable, it might as well be in Timbuktu. It doesn't matter. If the people in the community can't afford it, who cares, right? If it's affordable but low quality, well, fine, families can work, but the children aren't benefiting. And then further, the families aren't benefiting, right? Because low quality childcare has its own problems that can often manifest in poor behavior, in poor access, in multiple different family processes that can affect the family development. And of course, it's also suboptimal for the child development. So what we really want to do is get this high quality and affordable care scenario, this upper left-hand quadrant, right? That's optimal for economic and human development for children, families, and communities. But keep in mind that access also cannot be ignored, right? So when we talk about affordability and quality, those are two of the main ones. But if, for example, they're not open, if they're not close enough, if they, continually have turnover such that they're not able to maintain their accreditation, et cetera, it might as well just not be open either. So these three things, affordability, quality, and access, just all work in tandem when we conceptualize access to quality, affordable childcare. And then layering on top of that rurality as a consideration, it really brings this whole concern about how we conceptualize access to quality, affordable childcare in Kansas and Nebraska communities to bear. So what we did was so now I'm going to switch gears a little bit and talk about what we have done to date. I mentioned the Potawatomi County Child Care Task Force earlier. I worked directly with them on both the quantitative and qualitative measures, and we essentially my role was to provide a menu of different surveys and then work to balance this age-old question of quality of data with length of time to take a survey. And for any of you who have done community-based participatory research, that's the CBPR there, or sometimes it's referred to as action research, although CBPR is sort of an outcropping of that. Anytime that you're seeking information, there's always this balance. And so what we did was we created this hierarchy of what we were most interested in were adults who were either currently had care or adults that were seeking care. And then after that, and essentially, actually, it was adults seeking care. So if you had a child in child care, but you were also looking, that was condition number 1. Adults with care were then condition number 2. So if you weren't looking for care but had a child in care, you were condition 2. If you were a child care professional and weren't looking for or had kids in care, you were condition 3. And then everybody else was the general public. And then from a subset of that, or essentially, we also created qualitative measures, both sort of short answer elements, which some would argue are not qualitative, and I get that, and I'm not going to get into that here. But then we also had focus group samples that were from the same subpopulations and, same subsamples, and about 65 to 75 minutes each. And Jesse will talk a little bit about those, and Allison will talk about some of the results. As we go, I would ask Mark to put in the next poll question. I think he can pull that over. Unless there's no poll there. So what I would ask us to consider at this point is what do we think the most important factor for those looking for childcare in Kansas is. So you have cost, scheduling, location, trust, activities for children, and so the short answer here is that it's cost. And what's really interesting is that was true regardless of household income, which was somewhat stunning for us. But I don't want to get too far ahead of ourselves because I want to talk about how we did these things. But I want you to sort of think about these other factors as well in the context of our work. So to recruit participants, we did everything we possibly could. We had an online presence. We did the local newspapers. We have a hospital in our counties. And this is in Kansas. Jesse, our graduate research assistant extraordinaire, designed these flyers. We also had business cards that had QR codes on the back of them. We basically did everything we could to flood the market for recruiting. Our participants received compensation for participating in our focus groups and surveys. And the most important part of this, though, in the recruitment was very much having our task forces in each of our communities being those with whom we co-designed the study. So they were invested from the very beginning at everything, all the questions we asked, the length of the survey, who we were going to look at, all of it. So they were fully invested and fully involved. And so then when it came to recruiting participants, and from the very beginning, both Holly and I emphasized how important their roles are in getting this out to our families. And so we were able to do what we consider to be very, very well in terms of our participation. And so I'm going to turn it over to Allison now because she's going to go through these results. And please know that these results are just sort of an overview of what we found because the full report is dozens and dozens of pages long. So Allison, please take it away.
All right, happy to do so. All right, so we're going to just kind of go, this is really just skimming the tip of the iceberg. As Bradford noted, we have so many results that we could report, but we just want to really capture what we feel are some of the big themes that came across and that we saw as themes when looking at both the quantitative and the qualitative. So it was great to have the multi-method research there that we could kind of better triangulate what the issues are. So first we're going to talk about the Kansas results and then we'll discuss Nebraska. And we have chosen to really focus on those who have care and are seeking care and then the general public. We didn't get as great of a response or depth of results among child care providers. That's not to say we didn't get anything valuable, but just not the same level of response that we got from the general public and then the families who either are seeking or have care. So as we look at Kansas, you'll see that there is a very clear difference in median household income among those who are seeking care compared to those who have care. So we've got those who are seeking care are reporting the median household income there for that group was about $60,000 to just below $70,000, and then when you look at those who have care, it's much higher $90,000 to almost $100,000. And one of the important things to note here is that this is not a longitudinal design, right? This is cross-sectional, so we don't know, we don't necessarily know the direction of that relationship. So do people who have care, is it because they have more money, or is it that because they have care, they're able to be more engaged in the workforce and therefore they have higher income? So we can't really tease that apart, but I think that it's just really important to note that that's a really significant gap there. Then in terms of the barriers reported, so participants were asked to select from a list of, let me make sure I got all of the numbers right here. Okay, so they were asked to select from a list of 13 different options as barriers and select all that applied. And the top 3 barriers, as we're looking across, you see cost. As Bradford noted earlier, cost is the number 1, and that didn't matter regardless of, regardless of income. People were saying cost is huge. And then location is another area of similarity. And then, of course, we've got a little bit of a difference here in that quality of care was identified as one of the barriers of adults with care, and then the matching work schedule or operating hours was number 2 for those seeking care. But on the whole, a lot of consistency in what kinds of barriers they're facing. And then, interestingly, we see similarities in the type of care that they prefer. So they're saying they prefer a child care center. And things really got interesting here because among adults who currently have child care, they said that their current child care arrangements most commonly were care in a non-relative's home, but their preferred child care arrangement is a child care center. So only 63 of them, only 57 had childcare at a center, while 86 said that their preferred arrangement would be a child care center. So even when they have care, it's not necessarily their preferred kind of care. And then, one more important thing I wanted to note with regard to income is that if we're looking at adults seeking care, among those with household income of 40 to about 90,000, they were 2 times more likely to report cost as a barrier compared to those with 90,000 or above. So cost seems to be a factor for everyone, but it is also true that for families who are in the lower income brackets, they are more likely to experience that barrier, which of course makes good sense. Okay, so if we're moving forward to Nebraska, similar, our subsamples here are similar in terms of race and ethnicity, fairly close in the average age, but there again we see that gap. Those seeking care their median household income is about 30,000 lower than those who have care. So that was a really interesting finding when we compared across states, that we saw this pattern in both states. And then if you're looking at the adult seeking care, one really interesting thing we did here is, so instead of reporting barriers here, we're reporting needs. So when we did the Nebraska survey, we used some of the feedback and the results of the Kansas findings to modify some things and ask different kinds of questions on the on the Nebraska survey. And we asked not just about barriers, but what the most pressing needs were. So that really, and in my mind, asking them about what the most important needs are, that really sets it up to go to community stakeholders and say, look, these are the things that have been identified as gaps in the care, as really pressing needs. This is something that's a little bit more actionable, and I think you can really use that data to help communities make decisions about how they might respond to these issues. And then again, we see a clear preference for child care centers. So again, more people want their children in a child care center than those who actually have that available to them. All right, and I think, yes, now we're going to move into the general public. This is where things also got pretty interesting. So we're back to Kansas, looking at what the general public had to say with regard to a series of statements, their perceptions. Oh, sorry, we have a comment here. Hiring people more likely to have 8 to 5 jobs, so schedule is not as big of an issue. Good point. Okay, so if we're looking at the general public, we had a series of statements and we asked them to respond on a range of strongly disagree all the way up to strongly agree. And so what you're seeing here is we've collapsed across those categories, so that strongly disagree and strongly disagree and disagree are just being combined as disagree. And then agree and strongly agree are combined as agree. So we did collapse across there for simplicity's sake when we're presenting the findings in this format. And so what you can see here is that a very sizable number of people disagreed that families in their community had access to adequate childcare. And then the part that really made us excited is that people agreed, a clear majority agreed that access to quality, affordable childcare is an economic development issue. And then with regard to these various entities that could serve a role in addressing these issues, we were a little bit surprised to see so much agreement that federal or state government has a role to play and that county government has a role to play. Lots of agreement there. And then churches, there's some agreement there as well. And then as we move forward to Nebraska, saw some similar things. So again, we're seeing a very large number of people disagreeing that access to adequate childcare exists in their communities. And then the economic development issue, there again, we see a majority saying, yes, this is an economic development issue. And then even stronger support, right? Let me see. Yep. I was going to say, I think that's what I'm trying to say. Yeah, greater support in Nebraska for federal and state involvement to make services more affordable. And again, though, we're seeing some pretty strong support for county government. And churches, less support there. You know, the typical was neither agree or disagree. So people kind of felt like, meh, I don't really know. Not as strong opinions on that, but a lot of support for government to be involved. All right, and with that, I'm going to turn it over to Jesse, who will talk about the themes from.
Okay, so as Bradford said, we conducted focus groups for each of the 4 groups, just like we gathered quantitative data with. Our focus groups were recorded, we transcribed them, and then analyzed them using a constant comparative method. And really, these qualitative findings really gave us some depth into our quantitative findings, our results. They really reflected what we knew, just kind of gave us more insights. Some of the biggest things were people in these communities were planning pregnancies around childcare, whether that means they were planning it on their first child or deciding whether or not to have more. They were deciding to, postpone pregnancy if there were a lack of options or a lack of access. Kind of the first tier of the problem was, are there any openings? A second thing was, do they even accept infants? And then a third was, is this quality or licensed care? So you can kind of see the hierarchy of those needs there. As Bradford kind of alluded to in the matrix, cost does matter, but they told us they won't send a child to care if it ends up being more than their income. It's just not worthwhile to them. So even if it's affordable, the access is, the most important thing. Participants told us that they found child care through social media and word of mouth, specifically if it was unlicensed care. So they were kind of, figuring it out, trying to find the care wherever they could. They said, we know that there's a need in our community, and they would talk about that need, but at the end of the day, we just had to figure it out. There was no other options. I mean, what else were we going to do? Communities as a whole knew that this issue existed, but they weren't sure how to support it. My focus groups were all over the place. They really weren't sure, should it be churches, should it be government? They didn't know how, they just knew that there was an issue there.
Okay, and then before we get to the next part of the, to give you some context to those, we're going to just ask you a quick poll question, and it's really, has anybody ever thought that people needed to plan their pregnancies around childcare, meaning access to quality, affordable childcare? So yes, you've seen that. No, not until this presentation. Or heck, seen this movie. Heck, I've starred in it, which can certainly be the case for some. And in the interest of time, we'll close it out here in 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Okay. So 57% of you said that, yes, you've seen this movie before. And then 5 of you said no, not until this presentation. And 1 has starred in it. For that one individual, I'm so sorry. But I will say, this could be a gendered component, but I don't think so. This had not occurred to me that families were having to plan their pregnancies around the availability of childcare. So that was a real shock to us, and in particular to our stakeholders. So I want to just provide a few quotes here and let Jesse sort of summarize for you.
Yeah, so like Bradford said, these quotes that we're providing, they really just provide us, concrete examples of what our participants were saying. But I'll just summarize for you as you read. There were people in our groups that were deciding to stay home and open care just so that they had a place to send their child and also get an income. So that's kind of related to those pregnancy decisions. Again, cost matters, but if the care doesn't exist, it can't even be an issue at that point. If it does exist, the cost is absolutely overwhelming for families, we were finding, especially infant care, like Bradford alluded to. Infant care was just astronomical. And like I said before, access is a bigger issue in the smaller areas, in these more rural areas, but cost seems to be a bigger issue in the bigger areas.
All right. So after all that, we came to this realization that we need to reconceptualize childcare. And one of the most important things that we need to consider is that the cost of childcare is more expensive than tuition at either University of Nebraska Lincoln or at Kansas State University. In fact, the best way that I have conceptualized it is that you're essentially sending your child to private school. Right? And we all know who can afford private school. It's people who can afford expensive things. And so the issue there, of course, is that we know that there are benefits for families, for children, and for the economic development of areas. And one of the most difficult components of this is that we can't blame the individual families, parents, or primary caregivers. They do the best they can with what they have. It is not an individual, at least in our conceptualization, trying to put the sort of responsibility on families to make good decisions when no really good decision exists is patently unfair. And so we recognize that it's for the children should work, but it simply does not. And then what we continually find are these notions of balancing the individual responsibility, the orientation, which is very prevalent in our rural communities in both Kansas and Nebraska, with the understanding that rural communities are really suffering, and many are starting to fade due to aging out and lack of opportunities. And what we see often in our focus groups and in much of the other data that we collected, again, we barely scratched the surface, but is that there's a recognition of the need to do something about this, but no concrete way of approaching that. And so for us, after all of these this hard work, we really thought about thinking about access to quality affordable childcare as essentially a utility. It has the same level of importance to families, and particularly for economic, family, and child development as internet and phone and electricity, right? If you're trying to recruit and retain young families to come back to their communities of origin, if they can't work because they don't have access to quality affordable childcare, it becomes a very difficult proposition for them. Further, many of the families that would return have college or other trade school debt, and thus need to be able to work to earn the capital. And so we've started really thinking about, okay, we recognize that this needs to happen, and we need to pursue efforts that are a mix of public and private funding support. So using the economic development angle with those who need who need the workforce. So primary employers, hospitals are a perfect example. And we know how difficult the rural hospitals are having it these days, partially because of changes to healthcare, but also recruiting and retaining good talent has been an ongoing problem. And oftentimes that can be related to the access to quality, affordable childcare. And so what we really want to do is get at this three-legged stool of family, child, and economic development. We know the child development, we know the economic development, and then the great thing is, what's the number one thing people fight about? Money. If you have access to quality, affordable childcare and you're not spending 30% of your family's budget, which is oftentimes more than your house or rent on childcare, that can ease a lot. So what we're trying to do is really take this approach of using this as an opportunity, much like providing high-speed internet. And in fact, one of our partners in Potawatomi County is the high-speed internet provider in Potawatomi County, and they get it. And so what do we want to do next? Our next steps are, we want to expand some data collection. So one of the cool things is, as we move through this, several other communities in Kansas as well as in Nebraska have said, hey, we want to use this. We want to also expand data collection in Nebraska. That was my fault. I should just be one in. To have Spanish translations as well. We have a community out in the far west part of the state that is a majority Spanish speaking, and so we're really trying to accommodate that for their needs, for the community's needs, because I mean, really, language is not should not be a barrier in understanding what the community's needs are. And then finally, of course, our goal is to submit a proposal to USDA for funding for these communities. So using the rural community development grants to help them build on these data. So this is simply a starting point to help these communities, right? And this has been a really important part of our work. I do want to point out some of our successes, though. So one of the things that has happened as an outpouring of this and as an outgrowth of this is that we did get a child care center going in Onega, Kansas, which is in Potawatomi County, as a direct result of all of this work. So we were able to demonstrate very clearly that there's a need, and the hospital there was very much on board for multiple different reasons, but not the least of which is we know that employees who have access to quality, affordable child care have fewer sick days, are more productive, et cetera, et cetera. I mean, it's just a higher quality of life. Happy workers are good workers. I'm going to be spending the month of June in D.C. As part of a visiting scholars fellowship. And then I've also, my colleagues and I have given presentations to the National Council of Family Relations and then in a consortium at the University of Georgia on these methods and tools, and these are also being used across the country now. We were able to get some support from the Potawatomi County Economic Development Corporation. And then in Nebraska, their data is also being used to inform larger statewide needs assessments around this. And much like in Kansas, they're getting a lot of traction to expand this work. And so it's been really encouraging. But again, I can't emphasize enough that this is the first step in the larger process. This information can't just sit stagnant. We need to be able to act on it. And the first way that we see acting on it is conceptualizing it as utility and having community conversations with key stakeholders, which is across the board, everyone from childcare providers and parents to the head of the Chamber of Commerce and everyone in between. And that's our next steps, is to really get that going. I would be remiss if we didn't acknowledge the Potawatomi County Child Care Task Force, which includes Aaron Tynan, our extension agent there, Jack Alston, the CEO of the Potawatomi County Economic Development Corporation, but also Mary Altenhofen and the Boys and Girls Clubs, and Mary's at KDHE, our licensing body. We had the Chamber of Commerce, and then all of these Nebraska Extension educators who were instrumental in helping Holly Hatton Bowers achieve the results of their work. And then, of course, Rosa and Mark and our colleagues here in Kansas, Amy Baker and Christina Holmes. So with that, I think we're ready for some questions. I do want to just acknowledge that we do sincerely appreciate the support from the North Central Regional Center for Rural Development.
Okay, thanks, Brad. We do have just a few minutes for questions, and if you look on your Everyone tab under the chat, you'll see several questions. The first one was by Carol. Why did you choose county government rather than municipal boundaries or government?
That's a great question. I think particularly in our rural communities in Kansas, the way our governments are set up here, the county is sort of the most I want to say the most universally recognized in our communities. I can't speak for Nebraska so much, but the way our funding works in Kansas, everything that municipalities get, or not everything, but most of the things that they get flow from the county. And so that's why we asked. Although, truthfully, that's one of those things that we would likely revise moving forward, because we want to separate that out. I do want to say, though, that balancing the number of questions we ask with the amount of time that people take was a huge challenge. Our partners at the table really wanted to keep the amount of time to 5 minutes or less, and so you can imagine what we could do in that. But as a result, we got really good response rates. So, it's always a balance.
Tanya also has a comment about a county in southern Indiana that tackled the issue by creating a childcare center where the county economic development agency partnered with businesses and community members to make it happen. Just noting that it would be a great case study or compare with some others. Do you have other comparisons that you could make with Tanya's example?
Well, yes, absolutely. And part of what, and actually, Tanya, if you would, I believe my contact information is on the first slide, but if not, I will certainly send it out as well through the listserv that Mark has. But yeah, we would very much like to have that, because a case study there, because we're doing the same sort of thing in Potawatomi County around the hospital. So that would be absolutely ideal for us. We're really hoping to develop a toolkit, and not hoping to, we are developing a toolkit to help rural communities with this process so that they don't have to learn all the lessons that we did. As a result, they can still be successful. But my contact information, if you want to write it down, is bwiles, B-W-I-L-E-S, at ksu.edu. And then Steve asked, has children's finance in Minneapolis been included or consulted? No, I mean, we have looked at some of their materials, and we know that they have some really good guides, but because, and Allison, please correct me if I'm wrong, but I think that we looked and they were Minnesota-centric, meaning there wasn't access for those of us in Nebraska or Kansas to their actual funding. But yes, we looked at their models. We are looking at their models as we proceed with our grant proposal to make a difference in building these toolkits. So yes, we're quite familiar.
Bradford, this is Allison. I'm just going to chime in that you did a follow-up comment there that it does seem like their interest is more locally driven, so it is possibly something that could be negotiated with them.
Right, and that's the great thing about this too, is that because we've gotten so far on it, it's really encouraging, meaning that the information truly is power, that what we have seen time and again is that having these data really makes a difference for people being able to understand how crucial this is and what the far-reaching implications are. And then Dawn asks, Iowa Women's Foundation, 22 counties. Nice. If you have, yeah, I would love to see that toolkit. We could certainly work together on informing that and vice versa. I mean, we are really looking at creative ways to build in. And one of the things that keeps coming up for us again and again is balancing this, pardon me, but this really libertarian notion of we figured it out, you know, you're on your own, there's no good role for government, which we don't see very much in our survey results, but at some of the leadership levels we see this with the notion of communities coming together and the difference, the long-term difference that can make. And it's been the vacillating across different ends of the spectrum has been really fascinating, I think, for all of us involved. Yeah, please.
Yeah, just a question about, you know, you're surveying people who may have needs with childcare, and there are, you know, lots of benefits to the community of potentially subsidizing that and making it more affordable. As a public finance economist, I always think about, well, who would be willing to pay in the form of some sort of tax, whether it be businesses contributing so that they have access to potentially more workers and fewer sick days taken, et cetera, or people, you know, like what part of the community might be willing to pay a little bit more tax in order to have this kind of service in their community. and maybe even grandparents who might be leaned on more than they'd like to be would say, yeah, sure, that sounds good. So is there a coalition in the community or the county that would support this kind of effort? Have you thought about surveying not necessarily people who directly use the services, but those in the community as well?
So to answer your question, yes. One of the things that we did early on was actually talk to a number of the HR representatives. We didn't report on that here because in the end, I think, and Jesse, correct me if I'm wrong, but in the end, they ended up actually talking more like parents than they did as HR representatives. But yeah, so one of the things that we have noticed, and in particular with our economic development partners, is their desire to be supportive. So when we think about, in fact, I gave a presentation about a month ago to the Economic Development Corporation here in town, in Potawatomi County, and they're essentially at that point, Mark, where I think they're ready to, in fact, the question was, well, how much do you need and when do we start? And so I was able to say, well, we don't know how much we need yet, but as we get our grant proposal in, I talked very much with them about matching funds and then the sustainability component of how we can do that. And one of the models that we talked about is them essentially guaranteeing infant spots. So regardless of whether their employees have infants or not, maintaining those slots so that they are available for recruitment. The problem with that's not exactly the way I want to put it, but the barrier for infant care is that it is very labor intensive, meaning for every 3 infants, there needs to be 1 adult. As you get into the 4 to 5-year-olds, that's 1 adult for every 10 children. And so you can see that the return on investment at the infant level is very difficult, and yet that is the highest demand. And so oftentimes our child care centers will essentially have loss leaders for infants so that they can provide the care for as they age up to make it back. And so we're really trying to figure out useful ways to have our businesses subsidize those things so that they are predictable, sustainable, and accessible. And then the challenge there, of course, is the equitable component is, can someone who doesn't work there, if that slot's open, take that, or does it need to remain open, et cetera, et cetera. And we're trying to work through those things, but those are tough challenges. I would be, Mark, actually quite interested in having a follow-up conversation with you on how to mobilize these resources more effectively. We've looked at some of the community coaching models that have been used in the nutrition and physical activity domains here in Kansas. But if you have other approaches, we would be certainly extraordinarily interested.
Sure. I think we have time for one last question. Jan Flora is asking whether you've run into successful child care centers that provide child care hours needed by people with so-called flexible work hours. And I think then I will about be out of time. We'll have to close up.
Yeah. So the answer is not so much in rural communities. In larger urban areas, there are those who can do that. But in rural communities, what we typically find are centers that operate essentially on either side of the 9 to 5. So as early, I think our average opening time was 6:30, and our average closing time though was 6 p.m. So you can imagine that puts a bit of a barrier for families that are trying to get out of work right at 5 and only have an hour to get where they need to be, which might seem like a lot of time, but when you're living in a rural community, 30-minute drive is just down the road a piece, and so it is something that we have looked at. That was one of the questions that we asked in our survey, and Allison, I would ask you to chime in if I'm mistaken, or just chime in. But I think what we found were that the demand for, at least in Kansas, the demand for after hours or second shift childcare wasn't as important as essentially just having care, period. That it would be nice to be able to handle second shift, et cetera, but that what we were seeing was just an absence of care overall.
Yeah, yep, that's accurate. That we saw more nuanced findings in Nebraska, but in Kansas it was really just there's nothing at all.
Well, I think that's a place where we're going to have to stop for this afternoon. Thank you, Bradford, Allison, and Jesse for an engaging webinar, and thanks to the participants for joining us. And I think that's all for now. We'll see you next time. Thanks again.
Thank you, Mark, and thanks for everyone for coming and listening today. We really do appreciate your attending and participating.